Hackensack Meridian Children's Health is comprised of 2 nationally ranked children's hospitals by U.S. News and World Report and are number 1 in New Jersey. Hovnanian Children's Hospital in Neptune and Joseph M. Sanzari Children's Hospital in Hackensack, as well as pediatric inpatient and outpatient services at JFK University Medical Center in Edison. With access to expert pediatricians and over 200 pediatric specialists across the state, Hackensack Meridian Children's Health prides itself on offering specialized pediatric medical care and surgical expertise. To learn more about Hackensack Meridian Children's Health, visit hackensackmeridianhealth.org/kids. Welcome back, everyone, to the Monmouth Moms podcast. We are here in officially back to school. For my daughter, at least. But I think it's back to school week, essentially, in Monmouth County. Everything. Been seeing all friends and family posting different days, but all the back to school happenings in the middle of like a heat wave, which is funny because I've been complaining about the weather all summer, about how it was just like a weird weather, like summer, in my opinion. I don't know. But it's like so hot and the perfect week to be at the beach and the pool, and we're back to school. So funny how that worked out. But we're doing all things back to school. Today we are continuing our family healthcare series with Hackensack Meridian Children's Health. Today talking about back to school everything, right? So your kids being sick, I thought it was so funny. A friend of mine who her kids go to school in Fairhaven, they were getting out of the car, bringing the kids into school the first day, and there was playing "It's the Most Wonderful Time of the Year" for the kids. Well, for the parents, really, which I was dying. I was cracking up. But with that comes all the activities, the chaos that ensues, the homework, and also the germs and injuries and everything in between. So our guest today, thank you for joining, is Dr. Melissa C. Wallach. She's been a pediatrician for more than 20 years from Hackensack Meridian Children's Health. Board certified in internal medicine and pediatrics, Dr. Wallach sees patients in Neptune and Asbury Park. She is the director of medical education at Jersey Shore University Medical Center for the SGU Medical School Program, and counts among the many Hovnanian Children's Hospital pediatricians serving families in our community. She is also the Director of Quality Improvement for the Hackensack Meridian Children's Health Pediatric Primary Care Practices. So welcome. Thank you for coming and chatting with us today.
Yeah, thank you for inviting me to talk about this important topic, or topics, I should say.
Talking about a lot. We're trying to
potpourri
narrow down all the fun topics, right, that are back to school. So we'll dive right in. I am we have a lot of questions about illnesses in general, right? When you go back to school, everything from strep to flu kind of ensues. The stomach bugs, those are the worst.
Definitely for the moms, cleaning up the stomach bugs.
Oh my gosh, the worst. I have a fun story about a stomach bug I'll maybe mention later. The colds and everything in between. I will say I've noticed recently in the news a little bit more of a prevalence with COVID. I know that Rutgers actually instituted a indoor policy for masks for their students and faculty to be wearing. So what are you're seeing patients now. I'm sure this is kind of the first week that begins of all of the the illnesses. What do you normally see like in September? Is it kind of different like every year?
I feel like it's different every year, and I definitely think that the pandemic has definitely changed the time of year that we're seeing different viruses and bacterial infections. Like you mentioned strep. We didn't really see strep a lot during the height of the pandemic, and then all of a sudden it came back, and sometimes they're coming back, these bugs, at different seasons. Slightly off from what we're used to. But in general, now that we're going to be inside more and close together, we have to be conscientious of our coughs and our sniffles and the fact that, we are in close proximity and can spread germs to each other. And so I know you mentioned the masking. It's interesting because we did away with masks in the office around April. And at first I even sort of waited a little bit. And then, as summer went on, whether the child was sick or well, just got used to not wearing the mask again. And now that the COVID numbers are starting to climb up, I'm finding that I'm wearing a mask with, for sure, the kids that have fever, coughing, and sneezing. And I have a feeling we're going to probably start, some of us, to wear the masks more when we're in direct patient care. Because remember, in addition to seeing the sick kids that come, I'm seeing all the newborns that come right out of the hospital. And I don't want to be responsible for getting one of those babies sick,
sure.
right?
Absolutely.
So,
I also read that there is a new booster for I guess there's a different strain of COVID. Is that coming out soon?
So that's a very good question. So we're waiting for that. So the big companies have been working on a vaccine to prevent subvariants of Omicron, and they are saying that they are projecting that, even though I think it was possibly made prior to the most recent one that you might read about today, like there's all different letters of the alphabet. There's Iris, and then there's like the XBBs. It's like the hurricanes. Yeah, it's like the hurricanes. Like each one gets a different letter, like the Greek alphabet. This time the Greek alphabet instead of the traditional alphabet. But in any event, they're projecting that it probably the middle to the end of this month, and I don't know then from once the approvals come how long it'll take to actually have in offices. And but it will be a one-time dose for at least for the older kids and young and adults.
Got it. Okay. I also noticed, I guess maybe last year that there was a much prevalence of RSV. And maybe I'm off on that. Maybe I just knew people that had it more, but I just saw more about it. I know that babies get RSV a lot, and I don't know why that is. My kids have never had RSV. So it's a virus?
Yes. So it stands for respiratory syncytial virus. That's what RSV stands for. And it is a virus that anyone can get. But when younger children, really infants, especially premature babies, as well as over 65-year-olds of age are, the extreme ends of age, are more at risk for having higher complication in the lower respiratory tract requiring hospitalization. And so in the past, there was a monoclonal antibody called Synagis that was out, polyviximab, and it was given to very particular criteria in the neonatal ICU before they would leave the hospital, and sometimes they would have to they would need to be continued dosing throughout the entire RSV season, which traditionally was from October to April. And we're projecting it'll go back to that, although again, like I was mentioning earlier, COVID did kind of make things a little different, where we were seeing RSV earlier than we normally did, like prior to the fall, and extending later past April too. So, but hopefully now it'll go back to its traditional time of year, which is usually October to April. And so there is a new product out that's similar to this one, but instead of being every month that they would need to be dosed, it's a one-time injection.
It's a vaccine. And
it's interesting that you say that because to be technical, it's actually not a vaccine. It's actually a monoclonal antibody, so it's a therapeutic.
Okay.
But it's being classified as a vaccine because it provides passive immunization against the virus, as opposed to a vaccine that gives more active immunization. So, in other words, it gives your body something to help your body create a response in a little bit different way than the traditional vaccines work.
Is that how the flu vaccine works too, or no?
So no, they're different.
Okay.
Yeah. So it is a little different, and it's very new, and it has just gotten approval. And the biggest difference is that rather than being targeted just for premature babies in the ICU, the recommendation from the studies that came out is that it can be given to all babies that are 8 months of life and younger as they enter RSV season, and for their first RSV season, and then kids 8 to 19 months who are entering their second RSV season that have something like heart disease or serious lung disease that might make them higher risk for getting sick with RSV.
Okay. So what is the distinction between RSV? Is it something that you test for? Are the symptoms different between RSV and flu?
Okay, great. That's a good question. So a lot of these things are similar, like
Right.
fever, cough, runny nose. The difference with RSV, especially in the littler children, little infants, is it can inflame the airways, and as a result of that, it can cause them to make a wheezing sound and also have signs that almost look like what you think of with asthma, like increased work of breathing. So their chests might move rapidly, their noses can flare out, they can make a grunting sound. And the scary thing is that they can require oxygen, and so that could be very scary for a parent and not to know that. And so if the baby is having any signs of work of breathing, if you can get right away to your primary care doctor, that's fine. But if it's really a severe, sign of distress, that's probably when you just go right to the hospital for that to see if the baby needs oxygen supplementation and admission overnight to the hospital. But many babies that are bigger don't need to be hospitalized. They just might have really a ton of nasal congestion. So they have a lot of nasal congestion, need to aggressive suctioning of the nose, and that will help them to breathe better. There aren't really a lot of medications for it. It's not like the flu where we have Tamiflu, and it's not like strep where we give antibiotics.
Right.
So that's kind of a little bit more disconcerting for parents because they're seeing their kids struggle and be uncomfortable, and they want to help them. And we call it supportive care. So suctioning the nose, making sure the baby doesn't get dehydrated. If the baby can't take their formula breast milk, maybe give them a little bit of Pedialyte, which is an electrolyte solution.
Right.
And obviously going to the doctor to get advice and check on the baby and see how the baby sounds. And there are certain things that we can try, although it's interesting because, they're not strongly recommended. For example, like you think about asthma, you think about nebulizer treatments and albuterol. And they're really not recommended for RSV, except they do work in certain patients that have it. So there are some tools that we can try. Sometimes we just do saline through the nebulizer machine. Sometimes that will help.
Oh.
And we can try that in the office too to sometimes, see if it makes a difference on the baby after we examine the baby.
Okay. Yeah, back in the day, my nebulizer got a lot of use with all kinds of, pneumonia, and then also, I want to say just with like upper respiratory and like infections and stuff like that. So, can RSV be more advanced in older children as well, or you won't really see like them being hospitalized as much?
So it's rare over 2 years of age, not to say that it can happen unless, of course, it's, a 2 to 3 year old that has congenital heart disease or maybe very severe asthma,
I see.
or some other underlying, or immunocompromised from some other cause, then possibly. But for a healthy child that's over 2 years of age, it's quite rare that they would need hospitalization. They could still get the virus. So in other words, you asked actually before about, I think maybe you touched on like testing for it. So there are, similar to like the COVID test that we were doing in the nose, there are rapid antigen tests for RSV, also, and PCR tests where we can swab the nose and get a result. Sometimes the rapid one in the office, just like the rapid flu test and rapid COVID test. And that helps us to give the parents an answer. With regard to like management though, like you technically don't need to know that it's RSV to manage it if the patient clinically looks like it. But it is, sort of important to know because people just want to know, and also just they don't spread it to other people and things like that. But as far as like when, it helps the doctor to decide what to tell you, it doesn't really change that much. But it is important if they're going to get hospitalized because we never want to put a patient that has RSV in a room with someone that doesn't. We don't want to, just like we don't want to put a patient with COVID or flu in a room with someone that doesn't. So for those type of purposes, we definitely test. Rapid flu is important to test if we can. If you can come in within 48 hours of the onset of symptoms, because then we can give Tamiflu, and that can help to prevent the severity of the flu so that they hopefully, get back to school quicker.
Yeah.
Mom and dad can get back to work sooner, things like that.
So let's talk about the flu a little bit. I have, I guess I get the flu maybe not every winter for sure, but like I got it, and I got it actually right before, it was like the February right before COVID. So technically COVID was here, but we didn't even know it was, or it was like around. Right? March was kind of like when we shut down. And I was so sick. But I had the flu vaccine that year. I get my kids the flu vaccine every year. I'm like not the best with like, I'll get it some years and other years I kind of forget or whatever. But well, one, is the flu strain different every year? Is it the same flu? Like, why is the flu like more prevalent every year? And why is it important to get the vaccine for yourself and for your kids?
Yes, so all good questions. So we look before the flu shot comes out. They look at the flu that happens in the southern hemisphere because they have flu, like for example, Australia, a different time of year than we do. And so they can try to predict what strains are going to be prevalent, and they create a vaccine to prevent those strains. So for this year's flu vaccine, there's flu A and flu B. And I believe there's two types of flu A in the flu vaccine this year. The H1N1 component is new, but the other component is different. So in other words, sometimes there is a slight change to the vaccine. They try to do their best at predicting what strains are going to be out there, but to your point of like, well, I got sick anyway. Yeah, that can happen. So multiple reasons. One is that we may not have the exact version of the one that you have, but also sometimes even if you do, just like even if you had the COVID vaccine, you could still get COVID. It's that you would get a milder case of the flu. So I still recommend the vaccine because even as miserable as you felt, hypothetically, you might have felt even worse had you not had the vaccine.
Right.
And so that's what we teach, to say that we want to prevent serious complications, hospitalizations, and the vaccine is really the best tool to do that. And I know that a lot of people feel that they're going to get sick from this. Like, that's what I hear all the time. Oh, I don't want the flu shot because the flu shot's going to make me sick. But it's for the most part, we don't use the nasal flu one. You can do the flu mist, but if you get the inactivated vaccine, it's completely inactivated. So there's no live virus in that shot, so it cannot make you get sick. I think a lot of times what happens is people are maybe unbeknownst to them, they're a little under the weather. Then they come in and they get the flu shot, and then the next day they feel miserable, so they think that the flu shot caused it. Probably they were going to get whatever they were going to get. Not to say that you can't get a sore arm or a little fever from the shot, because there are local reactions you can get, but not the flu virus itself.
Right. And when you have the flu, like a severe case of the flu, it's not fun. So you really want to make sure that, you're preventing any type of downtime, because that, like, I don't know, it like kicks my butt. I'm not a person that gets sick very often, but when I do, it's just like you're down for the count. Like for a week, it's the worst.
Yeah.
So,
right. So no one wants to feel like that. So I feel like a little sore arm for a day or two is worth it to not get sick for a week, like the way you're describing.
Right. I can't tell you how many times I've been at the doctor with my kids, not hoping that it's something that's bacterial, but really hoping that it's something that can be treated with an antibiotic, because, typically, they recover much faster, right, than having it be viral. When you leave and you're like, oh, it's viral, I don't know how long they're going to be sick for, right? I have to take off of work for 3 or 4 days. My kid's miserable. But with different viruses, right, the flu and just respiratory viruses, treatment in terms for children, right? When they're spiking high fevers can be very, very scary. My daughter, we talked about this a little bit. She had pneumonia when she was little. And I guess depending on the fever, the doctor will say, you can do Tylenol and then in between ibuprofen to like really make sure that the fever goes down. But you can't give it at the same time, right?
Right. I mean, you should try to space it out a little bit. You don't want to overdose on one or two, on either of the medications. But if the fever is spiking like that 103, 104, and you just want to, and it's not coming down with just the acetaminophen, which is the Tylenol, then you can, wait an hour and give a dose of the ibuprofen to have them overlap a little, because, there's an interval between each of them. So usually like Tylenol, you can give as close together as every 4 hours, and ibuprofen you can give every 6 hours apart. So you can stagger them so that they overlap a little bit. And I don't recommend doing that for a prolonged period of time, usually hopefully until the fever breaks. Also, you can do a cool sponge bath, also put a cool cloth on the back of the neck or the forehead, and that sort of helps to bring the fever down quickly. And fever isn't terrible. I mean, I know it's scary because you don't want it to get super high, but it is the body's way of saying they're fighting the infection. It's just one of those things that is, obviously the child looks a lot sicker when they're having the fever, and so the most important thing is that when the fever comes down, that they can kind of act a little bit more back to normal. If they bring the fever down and they're still seeming like lethargic, then that would be obviously a reason to call the doctor to see like what's going on. Could it be a complication, like you mentioned, pneumonia, or God forbid meningitis, or something more serious like that?
Pneumonia, that's a progression of an infection, right? Are there different types of pneumonia?
So there's different types of pneumonia. You mentioned there's even viral pneumonia, and
I didn't know that.
And bacterial pneumonia. There's, fungal, which is very rare.
Okay.
But and then there's different types of within the bacterial pneumonia, different types of the most common bugs that cause common things like ear infections are similar to the ones that cause sinus infections, and sometimes can also cause pneumonia. So. But we do have some vaccines to help with those. So the pneumococcal vaccine, for example, which is Prevnar is the brand of one of them. But pneumococcal conjugate vaccine can help prevent and has definitely decreased the incidence of serious bacterial infections that we've had since it launched years ago. But and there's actually going to be there's a newer version that came out for adults and is going to be released soon for kids too. Actually, technically it was approved, but I just don't have it in my office yet, per se.
Okay. So the definition of pneumonia is then, is it inflammation of the lungs, or is it an infection of the lungs?
Well, it could be both, right? So as a result of the infection, you can have the immune system sends its cells to fight the infection, which then can cause inflammation. Sometimes there can be fluid even in the lungs. Sometimes they can have a pleural effusion, which is a complication of pneumonia. Sometimes if it's really bad, they can even get an abscess in the lung, which is a collection of pus in the lung, an empyema. But it is caused by an infection that then causes this immune response, which can lead to sometimes even that wheezy sound, just like we were describing with RSV. Sometimes they can have rattling in the chest too, that the doctor can hear when they listen, and then sometimes we'll get a chest X-ray. It is a clinical diagnosis, but sometimes we will get a chest X-ray to confirm it, especially if we're worried. Say clinically, I think your child has pneumonia. I don't like the way the child sounds, fever, cough, et cetera. I listen to the lungs, and I'm like, oh, this sounds like it could be pneumonia. So I give you the prescription for the antibiotic. You call me 2 days later, 3 days later, really no change or worsening. Then I may say, oh, let's get a chest X-ray, make sure it's not, getting a secondary complication from the pneumonia.
Okay. We also talked a little bit about strep. My son, clockwork, every year gets strep once a year. I don't know why. He just always does. It's just since he was little. But I guess not enough where it was ever where the doctor said that they needed to, talk about having his tonsils taken out. Is that a thing that still happens? Because I remember when I was growing up, I had a lot of friends, at least 3 of them, that had their tonsils taken out because they had perpetual throat issues, right? But is that not as common anymore? And is it only because you get a series of strep repeatedly, or are there other things that contribute to that?
Yeah, so you're right. I think that years ago that they were quicker to take the tonsils out than they are now, and I think there's probably multiple factors. One of them for sure is the fact that we have learned that the tonsils are actually protective and part of the immune system. So if we don't need to take them out, we don't. However, if a child is having recurrent episodes of strep, usually multiple in the same year, sometimes we can count a certain amount in 1 year, and then another criteria, a certain amount over 2 years period of time, then your pediatrician might send you to the ear, nose, throat doctor to say, see if this child should get them out. The other sometimes thing that happens is a breathing issue. So if a child is having snoring at night, they may get their tonsils taken out for that if they have sleep apnea. But again,
I didn't know that.
Yeah, so it's not an infectious cause. So there are some people that just have larger sized tonsils to begin with. And also, it's not always the same, but it can also be associated with children that are obese too, but and not everybody that snores has sleep apnea. So, but a lot of times, one of the things that they'll do now, if it is a child that has those symptoms and also may or may not have recurrent throat infections, a lot of times they will get checked for that before they have surgery because that they want to prevent that complication after the anesthesia. So just another interesting little thing. But
all the things.
I have so many things we think about, and I don't know.
So we talked a lot about viruses and illnesses, and this is the time of year that it kind of, you'll start to see more of that, but also other reasons, right, that moms and dads are making appointments for their child to be seen. What are some, we talked a little bit about mental health awareness in teens, tweens, and I'm sure even elementary school kids.
Yeah, I mean, I think that we certainly have been seeing it a lot on the news, but also really in the front lines in the offices, primary care providers, even prior to COVID. But I think COVID, obviously, having everyone home for all that time, and then going back into school, and then again, the rise of technology and how things are not the way they used to be. Sure. Back in the day when someone did some sort of silly thing at school, we kind of laughed about it and then it was forgotten. Now someone catches it on camera, they post it, it goes viral, and everyone's remembering what happened to this child. So just being aware of different forms of mental illness that can take place in school. Kids can be bullying, not just in person, but also cyberbullying online. And also, so if your child does seem like they're a little off to you, just to talk to them. And if you need your pediatrician to help also, you can bring them to talk to see if anything's changed with regard to their mood. As well as, if there's any issues in school learning, and I think we talked a little bit about, ADHD is another thing that commonly comes in through the school might notice it and bring it to the parents' attention. Oh, why don't you talk to your pediatrician? I think your child is, not focusing or is always standing up in class and interrupting and things like that, that we can at least sort of navigate some of the screening tools with you and then help you get a more further diagnosis if needed outside our office.
Okay. So when my son's 19, but when he was in third grade, he was diagnosed with ADD, and his pediatrician did perform the diagnosis, I guess, did some screening, some testing and stuff like that. And we primarily worked with her up until, and then in conjunction with the school and different resources that were made available to the child study team and just, kinds of all different modifications that were made to him, over the years. And it was definitely a challenging situation, but one that many parents experience. And is that something that, so you make an appointment with the pediatrician, how does it work now, where they're, for screening purposes, and where do they go from there if they are diagnosed?
Yeah, so I think, again, it could be multifactorial. It's more common once they hit school age. I think kids under 5, it's really hard to make the diagnosis of ADHD. Mm-hmm. Even in the little ones, sometimes we can make it. It does have to occur in 2 settings. Shouldn't just be happening at home, these behaviors, or just happening at school. It should be happening in both settings. And there are a few screening tools that we can use in the office. Some that are more overly encompass multiple things, not just that. And then there's some tools that are specific. For example, one of them is called the Vanderbilt tool, and that's more specific for ADHD. And so that could be filled out by the parents and by the teachers, and then bring it to us, and we can score it, and that gives us an idea if they score a certain way, and plus everything else in the history, right, that we hear about what's going on. We can kind of pretty much make the diagnosis that way. And then depending upon how the family wants to navigate, obviously we always encourage them to get a child study team evaluation done at school, right, to see if they qualify for services, because that does make a huge difference.
Totally.
Yeah.
There's definitely a lot to it. I would love to even have a separate podcast to talk about just all the resources that are available and just the different, I'm sure that there's been probably a lot more advancements too, since, I was going through it with my son, which is, a long time ago now. But a lot of questions, and there's a lot of, I'm sure there's a lot of parents that are kind of frustrated because homework time with some, when you have a child with ADD and ADHD is, not a fun time of night, or at least it wasn't for me. So I can definitely relate to anyone that, that is struggling with that right now. Let's go back a little bit to mental health. You mentioned, changes in mood. What are the guidelines for screen time right now, and what do you advise parents? Because I think a lot of it, like you said, is stemmed from, the screens, what they see, what they, we say, my friends and I say all the time, when we were kids, anything that happened at school stayed at school. Now it carries over to social media at home after school. And not only are they seeing, things with their peer group, right? But also outside of that, right? Everything who they follow and different apps and everything. There's so much to it. We could also talk about that. Could totally be a different podcast, which I'd love to explore. But what are the guidelines right now for parents?
I mean, certainly for the little ones, we always say no screen, but we're talking about school age kids. So, I mean, ideally, it's sort of unrealistic, the goal of no more than 2 hours a day that's not schoolwork related, okay? Obviously school screens, I mean, sort of is the goal, especially when we're talking about kids that also might need to be more active because they're overweight. So we try to give, we have this little mnemonic 5210, 5 fruits and vegetables a day, no more than 2 hours of screen time, not counting schoolwork.
Okay.
1 hour of dedicated physical activity, and 0 sugary drinks, zero, sodas and juices and things like that. And so I think, keeping to that, general, amount of time, I know it is kind of becoming really challenging to keep it to the 2 hours, but that would be a nice goal, I think, if you could, or a little bit, even if you have to go a little bit over that, and also being conscious of what they're looking at. Like you mentioned, there are some apps, and now like TikTok, I don't even know how old. I think some of the kids can get on younger than they really should be able to. I know that's more of a teenager app, but they see some silly things that are on there, and sometimes they'll try to imitate them.
Yes, the Tide Pod
we're
challenge.
talking about,
And so I think it's it just comes down to monitoring what your kids are looking at and staying on top of what apps they have and what they're doing, because I know it's hard. Believe me, I work a lot, and my daughter for the most part she's mostly with me, unless she's now back at school, but. I try to do my best to make sure that she's not on the screens too much, and that when she is, it's what are you doing? Even some of these games, it's they you think they downloaded an app, but it's has a chat with people that they don't whatever
oh, wow.
oh yeah, just a silly you would think it was a Candy Crush type game, and all of a sudden it's she's well, you can build a team, do you want to be on my team and stuff. So it's just I'm what, how did this so you have to really pay attention.
Right, because that's actually one of the things I do tell parents is that there are adults that it's scary that can pretend to be kids.
Totally.
And it's just like what you're talking about. They could go on that Candy Crush app that your daughter's on and say that they're also 8 years old, but they're really not.
Yes.
So,
No, you really have to.
So
I mean,
that's really scary.
I am trying to organize a podcast to talk about the what to know about internet safety for children, because it's there's some scary stuff out there, and we really have to be vigilant and make sure that we are keeping an eye on things, and not, you don't want to be the crazy overprotective parent, but I think it's better to be safe than sorry when it comes to anything on the iPads and the phones and all of that. So but
right, and
super important.
And reminding them that once it's out there, it's out there. I think a lot of times especially the teenagers, because they're feisty, right? They'll say, it Snapchat, it disappears, but there is always a way for it to be traced. And so just remember, they're not thinking about when they're adults, right? when they're forming careers and things, but a lot of jobs and places, right, will do searches before they hire you. So if they find something out there about you, so that's what we try to teach, our children, is to be really mindful about what you're posting. And,
Oh, totally.
Even when you did my bio, one of my jobs is being in charge of a group of medical students. And when we talk to them too about entering the hospital, obviously HIPAA protecting patient information, but it's also presenting yourself well when you're outside, you're now,
you are representing,
our hospital, and and be mindful of that, and for the residents too. So it's really important to remember, not to say that you're not allowed to have fun outside of work, but just being conscious of what you're doing and what you're saying and things like that.
Oh, really? It's so important. another thing that comes with back to school is back to extracurricular activities and sports. I'm sure that you see all kinds of sports-related injuries in your office. What are some preventative measures? We talked about wearing a cup, wearing obviously helmets, even if you're not in sports, but just helmets for bike riding
right.
and,
I was
and
just
all
gonna
of that.
say, yeah,
Yeah.
quads and
Right.
bike
Quads,
ride,
right. We don't have that at my house, but
I don't have it at my house, but I hear about it sometimes in the office. Yeah. Obviously, making sure they wear helmets, like you said, even for bike riding, was really important because head injuries are serious, and we want to obviously protect our brains as much as possible. And all the pads that you have to wear for football and baseball, and like you mentioned, the cup is important for the boys because they need to protect their genital area, because if they get hit there, sometimes they can have a twisting of the testicle, which is called testicular torsion, and that's really an acute emergency that needs immediate medical attention because it needs to be corrected. So I always tell when I'm counseling the boys in the office that are playing sports, or even in general, but certainly in a sport that they could potentially get hit there, just to not wait and not tell their parents that they have pain there, just to tell them right away.
Okay.
So.
Any obviously staying hydrated.
Oh yes,
is
very important.
Super important. Because the sports, it's still hot out, right? So if we're on this, it's 90 degrees and we're playing soccer. Anything else you tell parents, just to stay safe while they're getting into all these activities?
Yeah, so definitely, like you said, keeping the water bottles with them. Sometimes, but be careful with, some of the electrolyte drinks are okay, but the ones that have, caffeine in them, those energy drinks.
We were just talking about that the other day because of the for heart issues, right?
Right.
They're really marketed towards kids, like a lot of these energy drinks that they're are loaded with caffeine, and it can be very dangerous.
Yeah, there's actually, I read something, similar to what happened with asking the FDA to put halting on the sale of electronic cigarettes, and the things that the vaping, because they were marketed with the flavors to kids, that there may be now this idea about this as well.
Oh, interesting.
Yeah.
Because they couldn't have what actually happens? They have can they have a heart attack, or how does that work?
Okay. Well, so that's theoretically, I guess, depending upon if they have an underlying thing, but the fact that it could definitely cause an arrhythmia potentially with the rapid heart rate, with the depending, because some of them have quite a lot, I believe, caffeine in them, and the kids are thinking that they're just like a safe drink, and that's the thing. And like you said, they're being marketed to kids, so. So I think that's still to be determined what's going to happen with that. But yes, that would be the scariest thing that I would worry about, would be an irregular heart rate. And I mean, in an extreme case, maybe, I don't know how often they would have coronary artery disease to have a heart attack per se, but definitely an arrhythmia, which can also lead to the heart stopping depending upon how fast it goes, which could be scary too.
Yeah. I also read that there is some preventative measures for kids that are, I guess, maybe playing football and different sports to be screened, do different heart screenings. Why is that?
Okay, so that is part of when the children come to the office for a sports physical. We do ask the parents fill out a questionnaire, and a lot of the questions are trying to establish, is there a family history of sudden cardiac death? And if they do have red flags in that department, or if the child themselves says that they're feeling faint with exercise, dizziness, chest pain, then we may want to refer them, a lot of times in this case, to the cardiologist before we, as the primary care doctor, clear them, to make sure they don't have an abnormality in the heart. Because some of the abnormalities, when you hear about, what happened, even in the NFL, right? That was a different thing, but there is hypertrophic cardiomyopathy, which is something that they don't always have a heart murmur, so your doctor may or may not hear the heart murmur, and they also may not have symptoms. And so that's one of the things that, if there is a family history, we would want to get them cleared by the heart doctor first.
Interesting. Okay. I read something about it recently, and that they were, I guess, trying to create more awareness for screening children. But it's not a big part of the population that has.
Correct. Right.
Okay.
Right. It's not like every kid right. And because otherwise, because we've always sort of said, well, why don't they just get an EKG and echocardiogram on every kid then, so that we would just find every kid. But I guess that, to your point, where the incidence is low enough that I guess it hasn't been given as a formal recommendation for us to screen every kid with that level of screening. We just do more of like the physical exam, asking the history questions, and then if any red flags come up, send those kids to the heart doctor to get seen.
Okay. Speaking of screenings, I'm thinking back to all the screenings that we had as students in school, right, with the school nurse. I assume that there's been a huge uptick in kids needing to go to the eye doctor for all the screen time that they have, or am I wrong on that?
No, I mean that's interesting. I mean, we do as part of the well visit, we do like just the eye chart in the office, and then if they fail that, then we obviously send them to the eye doctor. Or if the parents come and say, hey, you know, I see my child is like literally standing in front of the television, or the teacher's saying that they can't see the board, then, but yeah, no, it's funny. I've never like sort of looked into like the exact incidence to see if it's increasing, but definitely, I think we're going to have probably over the long term in the future some sort of effects for all of us on our eyes, both with the.
I know it's affected me for sure, but I always had great eyesight. But then, like ever since I started spending so much time on a laptop and like on screens, like for work, I just feel like my eyes are always strained. But my daughter too, like same thing. She's, you know, she goes to the eye doctor now, and you know, is really just like wears glasses for reading. She's not very good about wearing them. But I think like when we were there, they were talking about how it's like, is it myopia, right? That's So, but they see a lot more, it's much more prevalent in kids because of the screen time. So, and then also I want to ask you about scoliosis. For screen, you know, they screen in school at what age?
So, you know, usually I'm not sure exactly if every school follows, you know, around 9 years of age would be on the younger end. Sometimes in our office, I'll look at them even younger than that. But the school nurse, usually it's definitely by middle school for sure, but they could theoretically start screening at the end of, like, you know, the end of elementary, I guess.
Okay. It's not genetic, right? Scoliosis?
Well, in some cases it is, but there's adolescent idiopathic scoliosis, which not necessarily is coming from the family, but it could be also related to their posture, to how they're. So I always tell them not to carry the backpack on one shoulder, try to balance it on both shoulders, if they fail the screen in the office, then sometimes we'll get an X-ray, and sometimes if they're having symptoms, we'll also send them to the orthopedic, the bone doctor, to get checked.
Do they still brace kids?
So it has to be pretty severe for bracing, and then super severe for surgery.
Yeah, I had it actually. I had a spinal fusion when I was 16, I didn't. I was never braced, and that was 25 years ago. So I'm curious if they brace the way that they used to, if the braces have made advancements and stuff like that. I know it's very uncommon. But when I was 16, I had like a 45-degree curve in my spine. So
oh wow,
yeah, so I had to have the spinal fusion, which was like a terrible experience. But I always ask about screenings and just making people like more aware, because it was a terrible thing to go through for sure as a child.
I can't imagine, because you have to wear the brace for almost like the whole day, so it's could be uncomfortable for the kids. But it is important to, if they do need it, maybe you can prevent a surgery if you get the bracing early enough. So in that case, it's, I guess, sort of a good thing, although it's uncomfortable.
Yeah, I always tell like my daughter, I'm like, sit up straight, like the posture, and she's like, oh my gosh. I'm like, it's this, you don't want to ever have to go through that. So, but it's, the kids, like always telling them what to do, and hopefully they retain a little bit and listen and not wear the backpack on the one side, because I was definitely guilty of that for sure as a kid. We talked a little bit about vaccines in general. So I think, I've always brought my daughter like just on around her birthday every year to the doctor. But what are, as the kids get older, what are some like reminders of vaccines that they should be getting outside of, flu and just, viral vaccines? Yeah.
So the routine, part of the routine childhood immunization. So, when we're talking about school, kindergarten, so there's, so it's interesting because those vaccines can be given as young as 4 years. Usually it's for like 4 to 6 years. But so if they hadn't gotten it when they were 4, if you're signing them up for kindergarten, once you bring those papers in, they're going to say, oh, you got to see the doctor. So there's 2 boosters that they get there. So it's a DTaP and polio, which you could give in one injection, and then MMR, which is measles, mumps, rubella, and varicella, which is chickenpox in the other. So that's for kindergarten. And then, other than the yearly ones you're mentioning, the next set of boosters come about at 11 years old when they're about to enter 6th grade or middle school, depending upon some schools, right? Or now it's all different, right? Some are K through 6, some are 6 through 8.
Yeah, they're all
I know
different.
it's all, but 6th grade and 11 years, there's another set of boosters, which is a booster to the tetanus shot, which also has protection against pertussis, which causes whooping cough. And we give that in conjunction with a meningitis vaccine. And then we also introduce the human papillomavirus HPV vaccine. The HPV one is not required for school, but it's strongly recommended as a vaccine to prevent cancer. And so we can give it. Actually, you could give that one as young as 9, but we sometimes will give it introduce at the 11-year visit. And then there's no other sort of routine ones again until 16 years of age. And then from 16 to 18, which is the range, you get a booster from your 6th grade meningitis shot that you got back when you were 11. And then we are recommending the meningococcal B vaccine, which is another meningitis shot to prevent the B strain of the meningococcal bacteria, because that's the serotype that was found actually in Rutgers that had an outbreak a few years back, and that one is not in the initial one that they get when they're in 6th grade. So there's like 2 separate meningitis shots, and then again, if they haven't gotten the HPV, I advise that again. And then then they're at college at 18 if they go to college, not everybody, but
Right.
they're out of traditional school, I guess.
Do you see a lot of your patients through college?
So we will see them in our offices. Usually our practices will be through until they turn like 22, basically.
Okay. I could see like a lot of guys just being like, I'll just go, like whatever,
Yeah.
like keep going until they're like,
Yeah.
oh, actually my son said that to me recently. He's like, should I just go to like a regular doctor now, or what do I do? I'm like, well, I think you can do either. It doesn't matter.
I was just going to say, it's right. It's totally whatever they want. I mean, some pediatric practices, I guess, depending upon their office, like once they hit 18, maybe they say, hey, it's time. You're an adult now. Go see the adult doctor. We've traditionally in our offices let them stay like through basically most of, like I said, the 21 to 22, although sometimes, the child, like you said, well, they're technically an adult then, right? They'll find an adult doctor by then. So
Got it. Oh my gosh. Well, thank you so much. This has been incredibly helpful information. There's a lot that we threw out with all the things that are back to school. It's back to just making sure that we're taking good care of our bodies and staying healthy and and being well and getting sleep. Oh, we didn't even mention that.
I know.
Yeah,
with all the screens too, right?
Yeah, no.
Cutting off the screens before bedtime.
Getting off the screen. Okay, yes. No more screens at bedtime. I've been better about that. Depends on the day, I guess. But yes, sleep is more important. What would you say is like actually the average amount of sleep that like elementary school age child should have?
They should really probably have 10 to 12 hours.
Yeah.
10 to 12, yeah. And then the older teens, you could maybe get 8 to 10, but
Oh, really? Okay.
But 10 to 12 for those younger kids for sure.
Okay. It's good to know. Well,
So.
thank you again. We are going to link all the information and where to find Dr. Wallach on anything listed here. So if you scroll down, you can see the link to Hackensack Meridian Children's Health, and any resources that we mentioned will also be linked there. Coming up this fall, make sure to check out the Mom with Moms Back to School Guide. We have lots of extracurricular activities listed in there, our tutoring services in the area. We also have our preschool and private school guide coming out in the next few weeks, so look for that soon. A salon and spa guide. We do one every year. We're bringing it a little bit earlier this year because, by the time October hits, it's basically the holidays and all things that are, you're juggling a lot. So you want to make sure you want to get those appointments in now and go get a nice facial and take some time for yourself because the kids went back to school before everyone gets sick, and schedule those appointments for hair and all the fun spas that are in the area as well. And we also have our fall fun guide coming out as well. We'll have lists of pumpkin picking, where to go apple picking, where all the fun events are happening. And speaking of events, coming soon, make sure that you're registered for our Fall Festival here at Bellworks, the Mom with Moms Fall Festival is Sunday, October 22nd. We have all kinds of fun things happening. Our Touch a Truck. We have over about 100 vendors that will have that day. We also have local food. We'll have Barbella open and a whole indoor kids zone with lots of new activities and fun things to do for Halloween. It's like a week before Halloween, so it's basically like it's like the kickoff to the holidays, right? We'll have all kinds of Halloween and fall festivities, and then you can actually shop early for the holidays. We'll have some cool vendors there, so make sure to check it out. We can't wait to see you there and enjoy all things happening for back to school this September. Thanks, guys.